moving on to the commoner diseases, which are lymphomas. So lymphomas are a little bit different from leukemias, because lymphomas, as leukemias, in leukemias the cancer cells are there in the blood, bone marrow, but in lymphoma they are restricted to the lymph nodes. So you might have seen, or you might be aware, that whenever a child or an adult is suffering from lymphoma, the typical clinical manifestations are that these lymph nodes are enlarged. Okay. Lymphomas can be of various types. So there's a huge classification. When we talk about adult lymphomas, there is a huge classification based on various factors. But to simplify, in pediatrics, we classify them as in two broad categories, which is a Hodgkin's lymphoma or a non-Hodgkin's lymphoma. Again, I would like to say that lymphoma is another success story, okay, whether in pediatrics or in adults. So if we pick up lymphomas in early stages, stage 1 or stage 2 lymphoma, the outcomes are phenomenal, more than 90%. Okay, so this brings us to the fact that early diagnosis in any cancer, whether it is leukemia or lymphoma, is very, very pertinent, because if you pick up these patients early, if you treat them early, then the chances of offering them a lifelong cure or long-term cure is much, much, much better.